Hello everyone. Today I want to show you some of my favorite exercises for nerve pain, specifically sciatic nerve pain. So that's pain that's going down the back of your leg. Sometimes it goes down into the calf or into the bottom of the foot. So my first favorite exercise to do for this is we're going to lay down on our backs. And then in order to keep your spine in a nice neutral position, we're going to keep the knees bent. From here, you're gonna hold on to the back of your thigh on the affected leg. So if this is the leg I'm trying to work on, I'm gonna grab onto the back of my thigh. You can use a strap if this is a little challenging to get to. And then from here, we're gonna start to slowly straighten and bend the knee. So we're gonna keep a soft foot for the first few repetitions and make sure this feels okay. If this already feels like a lot for you, then you can stay here with a nice relaxed foot. If you want to make it a little bit more intense, what we're going to start to do is coordinate toe flexion. This is also called dorsiflexion in the ankle. This is going to create a more of a stretch in the back of the leg. And then as we bend the knee, we're going to point the toe down. So we're putting the nerve on stretch. If you're very, very sensitive, like you're in a lot of pain, this might be too much for you. If that's a little too intense and you want to back off, what you can actually do is the opposite ankle movement. So you'll point the toe as you straighten and then flex the foot as you bend. This is more of a nerve glide. So there's a lot of areas that the nerve can get stuck either in the back of the hip, the back of the thigh, the knee, or even in the foot or the calf. So I would definitely try and practice on the side that's not bothering you first. And then if it feels okay, you can play with moving the foot either with the knee movement or against the knee movement. So pointing the foot is going to create more tension along the top of the foot. Flexing the foot when you straighten the knee is going to cause more tension in the back of the leg. So again, it could be the back of the thigh, the back of the knee, the calf, or even in the bottom of the foot. And I tell my patients to do 30 of these every day. Now, if you're doing that for a while and it feels like it's helping and it's good, then what we can also start to do is incorporate the head. So what we'll do is we'll lift the head and the neck and then release it back down. So holding the leg here and just moving the neck is gonna get the nerve that's a little bit closer to your spine. If you coordinate the ankle movement in the same direction as the head, that'll be more of a glide of the nerve throughout the entire path. Or if you flex the foot as you lift the head and then relax and point the toe, this will be more of a nerve tension exercise, which will feel more intense, especially if you have pain. Another version of this exercise that I like to do is in sitting. So this is a little bit less supported, so it can be a little bit more intense. And I would start again with the knee, soft foot, making sure that it feels okay. And then just pay attention to what's happening in your pelvis when you're sitting. Sometimes you'll start to kind of hunch, especially if you are having that nerve mobility issue. So we're going to sit up nice and tall, straightening and bending. If that feels okay, we can incorporate the ankle movement, either for tension as we flex the foot, or if you want to glide the nerve, then we'll point the toe as we straighten and bend as we flex. And then just like on your back, you can incorporate this movement with your neck movement. Point and keep the head straight, and then bend for a glide throughout the entire nerve. Or we can flex the neck, flex the toes, relax the leg, relax the neck. This will be a nerve tensioner. And again, nerve tensioners are going to be more intense than nerve glides. So if you're super, super sensitive, start with the glide. And then as you get used to the sensation or as your pain starts to dissipate, you can start to work on the nerve tensioner.